Hi and good afternoon to all. I am Dr. Jeyasakhthy Saniasiaya. I work with the Pediatric Otorhinolaryngology team in University of Malaya. Today, I would like to share my experience in starting a pediatric vestibular clinic. I have no conflict of interest. I would like to begin with a question. So how many of you have encountered a dizzy child? I recently conducted a survey to understand the awareness of vestibular dysfunction in children among otorhinolaryngologists in Malaysia. A total of 137 otorhinolaryngologists answered the survey. Among the participants, nearly 80% works either daily or frequently with children, of which 91.2% responded that vestibular assessment is not a part of routine assessment. Interestingly, 81% responded that the reason vestibular assessment is not routine is because the patient or the parent does not complain of either imbalance, dizziness, or vertigo. Upon inquiring on why it's not widely encountered, 42% responded it's due to lack of awareness of vestibular dysfunction in children. Well, vestibular dysfunction in children or pediatric is relatively a new field, and many may not be aware on how to diagnose or deal with this dysfunction. It's been just a couple of months since I embarked on pediatric vestibular, and I would like to share my experience. So, before starting a pediatric vestibular clinic, it's important to understand a few key points which I would like to share. So what do we know? Prevalence of vestibular disorder in children ranges between 0.7 and 15%, although the numbers may be higher due to lack of awareness, assessment, and published studies. Now you may wonder, if the numbers are so high, why do we not encounter them frequently? Well, children may not present with typical presentation of spinning sensation as adults, and it's important to understand that intact vestibular function is critical to child's physical and motor development. Vestibular-related impairments in children include gaze instability, disequilibrium, deficits in postural control, motor developmental delay, and vertigo, depending on the nature of dysfunction, age of onset, and the integrity of other factors that affect the impairment. There are a myriad of conditions causing vestibular dysfunction in children. Most notable ones include benign paroxysmal vertigo of childhood, vestibular migraine, otitis media, hearing loss, ototoxicity, concussion, prematurity, and infections like cytomegalovirus. Why do we need to assess vestibular dysfunction in children? Prominent effects of vestibular impairment in children include delay in gross motor function. So children with vestibular loss were reported to sit, walk, stand, and hold their head at a later age compared to age-matched peers who do not have vestibular loss. Next is learning disabilities. Visual tasks such as learning to read may be problematic for children with vestibular abnormalities due to impairment of the gaze stabilizing function of the vestibular system. This may impact scholastic performance, which in turn can lead to a reduced quality of life and suboptimal levels of education. So who are the team members? It's important to first gather a team. For a successful pediatric vestibular unit, multidisciplinary team is required. This team should include pediatrics ORL or the ORL specialist, audiologist, pediatric rehab physician, physiotherapist and occupational therapist who deals with children, pediatrician, and child psychologist. I also find it really important to collaborate and work with expertise from other centers. So in our center, we have pediatric ORL, audiologist, pediatric rehab, pediatric neuromedical, pediatric developmental physician, and we hope to get child psychologists on board in the future. So when performing vestibular assessment, it's important to have a comfortable and child-friendly room, as this will reduce anxiety and make the child more cooperative. It's important to be aware that most of these tests are relatively new to the parents or caretakers as well as the child. So go through the examinations and procedures with the parents so that they can help to support the child. It's important to get equipment that can aid the assessment and diagnosis. Start at least with 1 or 2 equipments. Get the staffs to be trained. Additionally, enroll into webinars and courses that are available. There are several websites and publications that can serve as a guide. One more thing I find extremely important is to liaise with experts in pediatric vestibular so that they can share their experience and guide on the best way to approach. In our center, we use Synapsys VHIT Ulmer system, whose remote camera measures hidden eye movement. VHIT test offers an objective assessment of the function of high-frequency domain of vestibular system. At first, we had a few training sessions in our center. Before doing VHIT in children, it's important to familiarize with adults. I started by performing VHIT on staffs and colleagues before doing it in child. Another equipment which we have in our center is posturography or smart balance in the rehab unit. This allows an assessment of the postural stability with and without influence of vision and property. Now the question is, when should you assess the child? It's important to make vestibular assessment a part or routine evaluation in all children seen. It's only then we may detect vestibular impairment, as parents or the child may not be aware of the impairment and it goes untreated. So when we have a child referred to us for dizziness, we first start with history taking. It's important to obtain a thorough history from parent or from the child when possible. It's pertinent to inquire if the child has frequent falls or appears clumsy, has difficulty climbing or descending stairs, child easily is nauseated in a car, or if the child finds it difficult to read signboard from car or looking out of the car, child has tendency to bump into objects or to misjudge distances, dislikes swings, has difficulty to learn to ride a bicycle, or has suffered from vertigo, dizziness, tinnitus, or disequilibrium previously. We usually inquire child's developmental milestone. Simple question which points towards child's development is able to give a guide if child's motor development is appropriate to age. A few questionnaires pertaining to vestibular assessment exist. We use the Vanderbilt Pediatric Dizziness Handicap Inventory in our center. All examination should begin with basic head and neck examination, including otoscopic examination. Hearing assessment is also routinely performed. Next, I find oculomotor examinations important. Oculomotor examinations such as smooth pursuit, saccade, optokinetic, and Vergence tests can be performed, and they are easy bedside examinations. Well, another test which I find really useful is the subjective visual vertical. SVV in our center is performed using bucket tests. It basically requires the child to rotate a straight line until it's aligned with their perception of true vertical. Next, we perform a dynamic visual acuity using Snellen chart. This provides a clinical functional measurement of vestibular ocular reflex. This is then followed by the modified clinical test of sensory interaction of balance, which is to assess static balance. This test is to evaluate the maturity of vestibular, visual, and proprioceptive systems and the quality of sensory interactions between these systems. I routinely perform VHIT in most children. VHIT can reveal corrective saccade during the head movement as well as VOR gain. Why use VHIT in children? VHIT is the first test that is able to evaluate all 6 semicircular canals individually. This test is objective and the equipment is compact. VHIT is less anxiety-provoking than the other semicircular canal tests. When performing VHIT in children, there are a couple of tips and tricks that I learned which I would like to share. So perform VHIT in a child-friendly room. Get parents involved. In child under 4 years of age, child can sit sideways on the lap of the parent or caregiver and face the camera. Once the child completes the test, reward the child by giving sticker or applaud. Child easily gets distracted, so minimize instruments nearby. And to maintain gaze fixed at target, if the target is affixed to the wall, avoid heavy wall decorations. Parents can help to redirect child's attention by using video played on cell phone, flashlight, toys, and having interesting sticker. The child may not want your hand placed on their face, so ask the parent to help by placing your hands over the parent's hand when performing head turns. Child usually has short attention span, so be patient. Performing head impulses in children is relatively easier than adults as there isn't neck stiffness. So what's next? Child diagnosed with vestibular dysfunction requires vestibular rehabilitation specific for children, which is focused on amelioration of impairments consequent to the dysfunction. This is where the pediatric rehab physiotherapist and the occupational therapist plays a great role. So what's next for us is to be equipped with caloric test, rotatory chair, and VEMP to aid in managing our patient. And what's ahead is vestibular infant screening. This is definitely something which we aim to do in the future. Several centers have started infant screening, which aims to provide an early vestibular screening for children with congenital hearing loss, and by increasing awareness of the impact of vestibular problems. This way, early diagnosis of vestibular deficit will lead to adequate referral for extensive vestibular testing, motor assessment, and rehabilitation if necessary. Pediatric vestibular assessment is crucial. Early detection will enable identification of vestibular-related impairments and early intervention so that progressive delays can be halted. Make vestibular evaluation a part of routine assessment hand in hand with hearing assessment in children. Start by simple questionnaires, easy and inexpensive bedside assessment. Lastly, and most importantly, be patient, because great things take time. Though relatively new, I am very grateful that I have all the support and guidance to set up a pediatric vestibular unit. Thank you all and stay safe.